Hello, I'm Dr. Brandt Gibson, and tonight I would like to talk to you about the next step, day number 4 of managing your peripheral neuropathy. And one of the big secrets of understanding and managing your peripheral neuropathy is knowing what types of peripheral neuropathy there are, and if any of those types are affecting you at this time. There are really 4 types of peripheral neuropathy. I'm not talking about causes. I'm not talking about any of those kind of things. I'm talking about the types of nerves that are affected with peripheral neuropathy. Number 1 is the large fiber sensory nerves. Large fiber sensory nerves are the nerves that come right from the spine. They're the larger nerves, they're the myelinated nerves, and they usually can actually get pretty significant injuries, pretty significant damage, pretty significant problems. And the idea with that type of peripheral nerve or peripheral neuropathy is the compression type neuropathy of the spine can actually cause this. The injuries to the axons or neurons or whatever can cause this, and you get pretty significant symptoms. If you were to do a nerve conduction velocity test or a EMG, electromyographic, the electromyogram exam of the muscles, in both cases, this could usually and a lot of times will show you large fiber neuropathy, large fiber sensory neuropathy. Number 2 is a small fiber sensory neuropathy. Now, small fiber sensory neuropathy are some of the more common types of peripheral neuropathy that you'll see. They're the most common type caused by diabetes, for example. They're usually symmetric. They usually are painful. They usually present in a stocking glove fashion, and they're pretty significant. And a nerve conduction velocity test is usually, if not always, normal with small fiber neuropathy, unless you have large fiber neuropathy as well. Number 3 is the motor neuropathy. Now, a lot of neurologists feel that motor neuropathy is very rare and isn't something that we actually see very often. I have patients where we actually see primary motor neuropathy, pretty significant motor neuropathy, and we actually treat it and are able to improve the symptoms of peripheral neuropathy and improve the functioning of those muscles by treating the motor nerves. And number 4 is the autonomic neuropathy, which controls the automatic function of the body, including the heart rate, the blood pressure, sweating, and all those kind of things. So when you look at these 4 different types of peripheral neuropathy, you can actually look at your symptoms and say, okay, what are my symptoms? How are they presenting? And what are the options as far as what we can do to treat them? Small fiber sensory neuropathy, large fiber sensory neuropathy, autonomic neuropathy, and motor neuropathy all have distinct, significant symptoms that you need to understand and you need to look at. And as you're looking at that, you can say, okay, I understand which of these. Do I have one of them, or do I have all 4 of them, or anywhere in between? And what do I need to do to truly get control of and manage my peripheral neuropathy? Each individual type of neuropathy can be treated and should be treated, but they're treated differently. And a lot of times they need to be treated individually to ensure that you get the treatment that you need. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 154. Peripheral neuropathy types, including large fiber and small fiber sensory neuropathy,